This is a special weekend episode of the Coronavirus Daily Briefing. I'm Brian McCullough. This week, we talked about the backlash to the idea of social distancing and lockdowns and the like. The idea was that before we even had a chance for any containment measures to take effect, we should somehow loosen them or abandon them in the name of saving the overall economy. I think I said on the show words to the effect of, that felt absurd to me. As someone on Twitter said, it's as if I was like, hey, my house is on fire and the fire department isn't even here yet. The house is still on fire, but I really miss my house. I really miss sitting on my couch. So I'm going to just go right back in right now and just hope for the best. Crazy, right? But thinking about it all week, I started to understand why some people might be having second thoughts. I mean, it's been nothing but 2 or 3 weeks of scary headlines and everybody suddenly being asked to stay inside and people losing their jobs and not being able to make rent or see their friends and family members. And this is the key part. No one knows how long this is supposed to last or what the end game would even look like. And I realized that that's it. People are being asked to do scary things and make scary sacrifices, but no one has told anyone yet what is on the other side of this. No one knows what the game plan is. And so that's making people feel confused and lost. Well, look, I've been reading everything there is to read about this for 3 weeks now, and it's not like there isn't a plan. It's not like there aren't options. There are tons of ideas out there for what the game plan is, what the end game is. It's just that no one in authority has laid it all out for us yet. So that's what I want to do in this episode. I'm certainly not in charge of anything. I'm not a scientist or a doctor or epidemiologist or mathematician. These aren't even my ideas. They're just ideas from others that I've been collecting after reading hundreds and hundreds of articles and posts and whatnot. I've all along been keeping a file of any time someone smart has mentioned what the next steps might be or what the light at the end of the tunnel might look like. So I've collected it all, and I'm just going to spew it out for you right now in this episode. I don't know for sure what the end game looks like, what the plan is, but I put together what other people smarter than me think it might be. I'm very much going to risk being one of those a-holes who doesn't know anything about anything but still pipes up nonetheless, so I encourage you to take what I'm about to say with a ton of grains of salt. But here's what I think might be the most reasonable path back to a normal life for all of us. I'm going to share every single link to every single source I'm drawing from here, no matter how small, so you can check my work on this. But here's what I think a reasonable game plan for the next several months might look like. First of all, there really are only 2 realistic end games. One is to have the disease infect enough of the global population that it ebbs of its own accord. When people use the term herd immunity, that's what they're talking about. But the second option is to come up with a vaccine. Now, option 1 is untenable because based on what we've seen so far, if, say, 70% of the global population does get this disease, it would mean millions dead. But the second is also untenable for reasons that people have been talking about all week. It's the reason for the backlash. We can't all stay home for 18 months, which is what people are assuming is the minimum timeline for a vaccine to be developed. But that's the point. This is not an either-or decision. We don't have to give up, but we also don't have to shut down society for the better part of 2 years. One of the first shows we ever did on this podcast, we ended with a mantra about testing. And in a way, it all comes back to that as first principles. We need to be able to test everyone we can, and I mean that almost literally. In order for folks to start to get back to work, we're going to need to be able to test the entire population, or at least segments of the population where outbreaks flare up on a regular basis. But I'll come back to that in a second, because really we need to start with social distancing, the whole staying home thing, the whole staying 6 feet away from other people thing. Again, I don't know if I really need to underline this, but social distancing can be effective. We have the example of China, a country of over 1 billion people that stopped the virus before it spread to 100 million people. China has recorded days of no new local cases. China has seen public transportation get running again, even in Wuhan in China, where the disease originated. China is slowly coming back to normal, all because it locked down. It did take 2 months of lockdown for China to affect this outcome, and it may take that long in Italy or Spain or even here. But China's economy is coming back to life, and Italy's will too, and ours will too. It just takes time. The Hubei province in China started locking down on January 23rd, and they first started lifting pieces of the lockdown on March 13th. That's 51 days, the better part of 2 months. That might be a long time, and it might suck hard for global markets, but as Bill Gates said in his TED video interview this week about the lockdown regime, quote, "It's disastrous for the economy, sure, but the sooner you do it in a tough way, the sooner you can undo it and go back to normal," end quote. So we need to let the lockdown and social distancing regime have its effect. We need to make sure our healthcare system isn't overwhelmed by a peak of cases all at once. But, and this is the equally important thing, a lockdown of, let's say, 6 to 8 weeks also buys time for us to test our way out of this. Let me give you this timeline. Let's say we all 100% lock down tomorrow. It takes 4 to 6 days for the disease to incubate, right? But let's say we tested every single person that developed symptoms after that first week time period, and then it takes, let's call it 2 weeks to get the results back. So in something close to a perfect scenario, you get a handle on the current situation, the current caseload, in 3 weeks. And then you allow maybe another 2 or 3 weeks for the outlying cases to trickle in. This is where I think and hope Italy is now, and this is also maybe where we are here in New York City, though we're only about halfway through that initial 3-week period, and certainly not even halfway through a 6-week period. But let's say you give a hard lockdown regime a total of 6 weeks, best case scenario. That's just to calm the storm, flatten the curve, deal with what's already out there. But 6 weeks isn't so bad, right? If they came out tomorrow and said, hey, everybody, 6 weeks hard lockdown, it would be scary, it would suck, but at least we'd have a timeline for phase 1. In the 6 weeks, we would also be able to begin phase 2. You've probably heard the term used a lot. It's called contact tracing, tracking and tracing. We can't do testing and tracing now because we don't have enough materials, but if we had 6 weeks to accumulate that stuff, the personal protective equipment, the materials needed for testing, we would be able to enact phase 2, the phase that would actually allow us to begin to get life back to normal. The reason that places like South Korea and Hong Kong have kept caseloads low even without locking down their cities is because they had enough tests and enough masks and gloves and lab coats and other personal protective equipment, and that's what we need. 6 weeks of lockdown would also buy us time to continue the efforts of stockpiling and stocking up, not only to protect healthcare workers now, today, but also to prep ourselves for the testing and tracing phase. Testing and tracing means identifying everyone who has symptoms and getting them into isolation immediately. And after you do that, you trace everyone that they've been in contact with, and you have those people go into isolation. This is exactly how South Korea and Hong Kong and Singapore and Taiwan and others have done it so far, keeping their numbers low with reasonable success. So, again, phase 1, 6 to 8 weeks of lockdown to flatten the curve. During that 6 to 8 week period, we pump out as many tests and as many masks and gowns and gloves and everything else to set up phase 2, testing and tracing. As Trevor Bedford tweeted, transmission routes can be reduced by a huge rollout of testing capacity. If someone can be tested early in their illness before they show symptoms, they could effectively self-isolate and reduce onward transmission compared to isolation when symptoms develop. This rollout of testing could be achieved through at-home delivery of swabs, with centralized lab-based processing combined with drive-through testing facilities. There are logistics involved in getting a result quickly, but it's really just logistics, which can be solved. As Yishan Wang wrote, quote, lockdown does not defeat the virus by itself. The lockdown buys you time to ramp up factories to manufacture tests, setting up testing checkpoints, and educating your populace on the testing. Before the lockdown, you had no testing. After the lockdown, you have free widespread testing. That is the key variable you changed. You use the testing to identify the remaining infected people and isolate them. You then keep on testing so that the handful of odd cases that pop up from time to time are identified quickly and isolated, so everyone else can keep on living and working normally, end quote. This is what I'm talking about. Again, phase 1 is treating the surge of cases baked into the cake already. Phase 2 is about getting testing and tracing regimes into place. And let me focus now on the second part of that. Literal teams of people able to go out and do the flip side of the coin, the tracking down of any people that infected persons have been in contact with to isolate them as well. That is how people go back to work. If we could say 6 weeks from now, okay, everybody, you can begin now to cautiously leave your homes. Yes, it's risky, but if new breakouts occur, we will have SWAT teams in place to swoop in and lock down not a whole city, not a whole state or whole country, but localized hotspots, even just individual buildings or even streets. It wouldn't be like flipping a switch, hey, everything is back to normal all at once. It would be a cautious and gradual thing backstopped by a growing confidence as testing and tracing teams were proving able to cut breakoffs off at the knees. But Brian, you might say, where can we find people to do this testing and tracing? Well, I don't know. There are now millions of people out of work right now in America. Politicians are passing trillion-dollar packages to attempt to get people back to work, but what if we could pay right now, tomorrow, tens of thousands of out-of-work Americans really, really well to work for several months to do the testing and tracing? Testing and tracing doesn't necessarily require medical expertise. It just requires the ability to run the tests and then do the actual legwork of going out and finding people and getting them into isolation. And maybe also checking in on them and making sure they stay in isolation and are doing well as they recover. Once we have enough materials, once we have enough masks and gloves, the overall PPE materials, so that people are reasonably safe to perform this job, but also, crucially, quick tests with quick results that are easy to administer. You don't have to be a doctor to do it. More on that in a minute. There's no reason why phase 2 can't happen. Again, step 1, lockdown, 6 weeks. But then step 2, 6 weeks from now, tests are ubiquitous, they're easy to get, they're free, they can be distributed to everyone in the country. We can be mailing them to people's homes if possible, maybe even using the emergency measures of the post office that we talked about on the show just this week. We have people on street corners, at the entrances to buildings, buses, airplanes, trains, all public spaces, taking people's temperatures, administering tests. Under this sort of system, as Doctors Carroll and Ja wrote in Atlantic, quote, we can keep the number of those who are exposed to a minimum, focusing our attention on those who are infected and enacting more stringent physical distancing only when and in locations where that fails. We can keep schools and businesses open as much as possible, closing them quickly when suppression fails, then opening them back up again once the infections are identified and isolated. Instead of playing defense, we could play more offense. Yes, offense. As Thomas Payo has coined the phrase, first comes the hammer, then comes the dance. The dance is phase 2, when you begin to bring people out of isolation, but you have those test and tracing teams in place to quickly do the SWAT-like actions to put out flare-ups when they happen. As Sagar Enjeti of the Hudson Institute has tweeted, in that period of life, things will look different, but it is possible, and it is possible soon. On to step 3, and this is where it gets interesting, because step 3 introduces an entirely new factor that we've not even dealt with yet. Once you have an effective testing and tracing regime in place, you will begin to have people who have recovered. So what happens some weeks after those people have been isolated because they are sick start coming out of isolation? Well, so far we believe that once you have contracted COVID-19, you're immune from getting it again, at least for some period of time. Caveat, we don't know this for 100% certainty yet, but it certainly looks that way. And if it bears out, then it would turn out that previously sick people would be able to be the vanguard, the first people truly back to the workforce in a major way, the first people that would be able to return broadly to normal life as we knew it before. And all the other people in isolation who never caught the disease can cautiously join them returning to the workforce because, again, the test and trace regimes would be there, but also the recently infected and recovered would be there and no longer in danger of spreading the disease to anyone else. This is quoting the Washington Post. Those with presumed immunity could then deliver goods, bolster hospitals, and restart the economy without worrying about transmitting the virus, end quote. Think about it. When is the next time you expect to be able to see your dentist, for example, to be able to confidently go out and get your hair cut by someone else? What if businesses started reopening early this summer with certified guarantees, maybe something like green color-coded signs on their door that indicate they are staffed by either recovered and immune people or, to some degree, by certified uninfected people? It would create a whole new dynamic. A weird one, to be sure. Can you imagine how in demand those guaranteed immune people would be? They'd be worth their weight in gold to the overall economy. But it would be the first meaningful step to normalcy. This is what Larry Brilliant, the epidemiologist who helped eradicate smallpox, told Wired magazine, quote, "Maybe most important, we begin to see large numbers of people, in particular nurses, home healthcare providers, doctors, policemen, firemen, and teachers, who have had the disease, are immune, and we have tested them to know that they are not infectious any longer. And when we have a system that identifies them, either in concert with a wristband or a card with their photograph and some kind of stamp on it, then we can be comfortable sending our children back to school because we know the teacher is not infectious. And instead of saying, no, you can't visit anybody in nursing homes, we have a group of people who are certified that they work with elderly and vulnerable people, and nurses who can go back into the hospitals, and dentists who can open your mouth and look in your mouth and not be giving you the virus. When those three things happen, that's when normalcy will return," end quote. So for phase 3, we also need, let me introduce you to a new term you should be looking out for: serological testing. Serological tests would be blood tests to identify individuals who have recovered from coronavirus, have developed antibodies, are no longer shedding virus, and are thus safe to go back out into the general population. The good news is we have priors for serological tests. The most widely used tests for HIV have been serological tests, and these types of tests are rapidly being developed. Researchers at Mount Sinai's Icahn School of Medicine have made the first serologic tests for COVID-19 in the U.S. just earlier this week. They are rolling out right now. Governor Andrew Cuomo earlier this week called on the Food and Drug Administration to immediately approve these tests. The country of Great Britain has reportedly ordered millions of these tests produced. This is quoting from The Telegraph. An antibody test can detect if a person has had the coronavirus before and has since recovered. The test, carried out by a device that pricks your finger for blood, works this out by testing your blood for coronavirus antibodies to see if they have already beaten the virus and gained some immunity to it. It can do this in about 15 minutes, end quote. This is quoting from Reuters. Antibody tests won't face the same bureaucratic hurdles diagnostic testing initially did. The U.S. Food and Drug Administration relaxed its rules last month, and body fluid tests, serologic tests, can proceed to market without full agency review and approval, end quote. And, quoting from Bloomberg, Henry Schein on Thursday said its point-of-care antibody test, which looks for evidence that a person's immune system has already fought off the infection, was available. The blood test can be given at the point of care and delivers results in about 15 minutes, though it can't be used to definitively diagnose a current infection, end quote. So in phase 3, we have serological blood tests to certify immunity, joining the swab test results that we've already been using to determine who currently has the virus. Guess what? Just this morning, news has been breaking that Abbott Labs has developed a COVID-19 test that can tell if someone is infected currently in as little as 5 minutes. The test is so small and portable that it reportedly can be used in almost any healthcare setting. The plan is to have 50,000 of these tests available starting April 1st. This has been trumpeted everywhere this morning. I saw the news this morning, first from Eric Feigl-Ding, the epidemiologist. And so if this bears out, this would be huge. We could have the serologic tests in place next week, And we could have the quick results test, key for the test and tracing regime, also in place by next week. So, to conclude, this is the possible game plan for the next couple months. 4 to 6 weeks of a hard lockdown to survive the current onslaught of cases already in the pipeline. To give our healthcare workers a chance to survive the onslaught, but also 4 to 6 weeks to build up the equipment necessary to have the testing regimes in place. We've got these quick tests coming. We've got these serological tests coming. In 4 to 6 weeks, we could hopefully have enough of both to begin to allow people to come out of isolation. We could hire enough workers to have testing regimes outside of every building and on every street corner we can manage. And we can have enough supplies in order to protect those people. All this is possible over the next month. And then in May, we slowly have people returning to work. And then maybe by July 4th or mid-July, the majority of our normal routines can start resuming. What if I had told you 2 weeks ago that yes, society is going to have to freeze in place for a while, but the freeze will only be for 6 weeks on the outside, and then the thaw will begin? What if I told you 2 weeks ago that normal life could return in 2.5 months tops? That might not be as fast as some are hoping, but it's pretty fast considering what we're facing, and it would at least show measurable progress to people and give us all hope. And at the very least, knowing that, having a timeline would give people a goal to work toward and for. It would also allow society to return to some form of normalcy while we wait the expected 18 months for a vaccine to arrive and put this all to bed for all of us, hopefully for good. That's it. That's all. That's my modestly proposed game plan. Please check my work, check all the links in the show notes. Please send in corrections if I've gotten anything wrong. But please consider this as a possible way forward. And if this is your first time listening to this podcast, please subscribe because we do a quick 20-minute episode recapping the latest COVID-19 news every single morning. Be well, everybody. Talk to you on Monday.